Our Health Minister, Zweli Mkhize, has told MPs that the country has passed the COVID-19 storm as fewer cases are being reported. 630,595 infections and 14,389 deaths have been reported in the country since the start of the outbreak. For the latest on the pandemic, we're joined by the National Institute of Communicable Diseases, Professor Adrian Puren. Professor Puren, good evening and thank you so much for your time tonight. Now, of course, much of the focus in the country starting to divert to different things as, the lockdown levels have been eased. But of course, COVID-19 is still with us. At the NICD, are you feeling that we are over the worst? Because you're the one dealing with all of those tests and information and data from a centralization point of view.
Absolutely. So I think we should not be complacent, but it is important to realize that when you look at the different data sources, for example, if you look at the number of hospitalizations, the numbers of deaths, and look at also, and that includes excess deaths, for example, and we look at the testing coverage, these are all good signs that, in fact, we have reached the peak and we are starting to see a decline in the numbers of cases. We're still seeing cases every day. We're not seeing the levels of testing that we've seen before, but certainly the coverage or the percentage numbers that are positive have certainly declined. So these are all good indicators to show that, in fact, within the last 2 weeks or so, that in fact we have indeed reached the peak as a country and now are seeing the slow declines in cases.
How does this affect your approach or strategy?
So I think there'll be more intensive discussions because, as you've seen in other countries, for example, in Europe and the UK and the United States, that as they went through their different phases of their lockdowns, in fact, in order to stimulate the economy, people coming together, schools opening, we've certainly seen either spikes or surges in cases. So that's going to be a critical event that we need to observe and ensure that we try and avoid that as far as is possible. I think we may not be able to do that, but it's really going to be critical to ensure that we have the ability to test regularly, and to be able to trace those individuals that are identified as being infected and then track their particular contacts. So South Africa has launched another mobile application, which I think we would like to encourage many people to download, so that when they are tested and have their results, they are able to provide information to then trace their particular contacts. So that's one very important step that we need to take in order to ensure that we can try and keep this epidemic in control as much as possible.
Professor Puren, if I'm hearing you correctly, we've seen, the health department withdraw some of the resources that had been deployed. They've shut down some of the field hospitals. But if I'm listening to you correctly, it doesn't sound like there's going to be any reduction in terms of capacity from the NICD.
No, so the NICD's perspective is that, yes, we're seeing lesser cases, but we still need capacity, especially when we have the likely surges that will occur. So hospital capacity still is a very important consideration. It may not be the required level that we have required in this initial surge and peak, but it's still essential to have hospital facilities available. And of course, it just comes back to the point that I need to emphasize, just watching some of your clips, is that the non-pharmaceutical interventions, the wearing of masks and wearing masks properly, the physical distancing, the hand hygiene, these are still the very key elements in order for us to try and maintain lower levels of transmission of this particular virus.
One of the key things, of course, has been the role that the NICD has played in the region and the support that you've also been providing in the region. Talk to me a little bit about that in terms of the general outbreak of COVID-19 in the rest of the continent and the support that you've been providing.
So that's not been an area that I've been fully active in, but I know that the NICD, as a national influenza center, for example, would provide technical support. And for example, I'm aware of support that's being provided to Lesotho, but various other countries, for example, very often look to the NICD in terms of the way in which it's developing its protocols and so forth. And of course, we have the Africa CDC as well now, very key partner in these activities. So the NICE, together with these particular organizations, are trying to provide levels of support to these countries, whether it be technical support or testing and so on.
What would you say were some of the biggest lessons that were learned that came out of South Africa's peak of COVID-19?
Well, I think it's really having good data. I think that, and data based on laboratory testing. As you know, the WHO emphasized very often that testing is a key pillarstone for our understanding of this particular epidemic. So I think it was very good to see how we've tried to manage that. I think there's still challenges with that, but I think it has given us an opportunity to think about how we approach this, especially as we run down the number of cases, what it is about that testing that will be really critical, and also around data and data management. I think that the data is so key, so critical to our understanding and informing how we approach the epidemic. I think those are the very key lessons. And I think the other is the hospital coverage and data coming from hospitals. I think, again, we've tried to put together, in collaboration with the private sector as well as the public sector hospitals, to try and get a sense of what's actually happening in the hospitals in order to provide important critical information as to what are the requirements in the hospitals in terms of the numbers of beds, oxygen requirements, and so forth. I think lastly, I'd like to comment on the modeling exercises. I know we can be fairly critical about models, but these have really been critical in informing us what are our requirements in order for us to meet if there were a really dramatic surge in cases, for example. So I think all these particular areas, the laboratory, the modeling exercises, the data collection, these are all key parts that I think that we've learned a great deal about and will inform how we proceed.